Oxford University researchers have found that a widely used heart medication also reduces a person's subconscious level of racial bias. Propranolol, a common beta blocker for heart disease patients, also works to stop the brain's automatic fear and emotional responses on which racial discrimination is based. Researchers were quick to point out that although these side effects raise interesting possibilities, the drug should not be construed as a cure for racial hate crimes.
Well, first of all, I do want to mention this was a very, very small study. Even the people who published the study said that this by no means proves any one thing, but this is a drug that's called a beta blocker. What it does primarily is it slows your heart rate, in turn can lower your blood pressure. It decreases the symptoms of a massive adrenergic response, which is the fight or flight response. And there were some theories, I don't know if you guys read this article, but theories that maybe if people were a little less stressed, and maybe they were less inclined to be prejudiced at a subconscious level. I don't know. That's the only explanation I can think of.
They actually thought of fear,
Yeah.
the association between racism and fear, and if somehow that calms the fear down, it may actually decrease the, the anxiety.
And some people use beta blockers to block their fear, like stage fright, things like that, and they're thinking maybe it could help racism. Also, there's a thought maybe it might help with PTSD, post-traumatic stress disorder, too.
So clearly it does have a sedating effect, propranolol, and maybe it has some sort of central effect as well, so it stands to reason.
Whether or not it's, they definitely say it's not a cure, and I think it's much more complicated. Not that anybody wouldn't be against a pill for racism, but
Right.
I don't think that's probably the answer.
Probably never going to cure that.